Okay, we're talking about being prepared for clinical. So we're going to talk about the pre-clinical manager. So to start with, we're going to the hospital, right? You're going to go to the hospital and park your car and you're going to go in. What you need is a piece of paper to take into the hospital with you. Okay, and now you are assigned Richard Royer, and you have to look up his information to take home to see what you need to know. So what I want you guys to do is to go to SimChart. Everyone sign in first. Is everyone in on SimChart? Okay, then you're going to select Case Studies. And then do the first one, Richard Royer, Pre-Clinical Manager. And so then open this up. And go through the screens and read it, and then start the case study, and then you should have a screen such as this. So go ahead and start your unfolding case study. Okay, when you're at clinical, what we want you to do is go in. This is where we're at now, right? We're on our unit, we found our patient, and we're in the electronic health record. We want to know what their admitting diagnosis is. We're going to want to know any of their other health problems, such as he has diabetes. You're going to search through that. And you also need to find the medications that they're on. So when you go to the hospital, this is what you're going to gather. And then we're going to take that home. So get your piece of paper out and see where you can find where this information is. Some places that I can help you look. Under summary, you usually will have your diagnoses. If you go under provider charts, you have orders. You have a history and physical. The progress notes, so you can find some of that stuff there. And then under this here, MAR, what does that stand for? Can't hear you.
Medical administration record.
Very good. You'll hear it said the MAR, the MAR, medication administration record. When you're looking for patients' current meds, this is a good place to look. If you open it up, you will see the list of scheduled meds right here. And that you can get their list of meds from there. Yes?
Where it says like action and like there's the sign that says like real on the right, is that the...
This here is action. That means what the nurse's actions are to give or not to give. This is a computer. These little buttons here, if it is time to give it, it'll turn green. If you look at my charting at the top here, it's saying it's Thursday at 6 o'clock. Do you see 6 o'clock for the dosage time for any of these? So it's not time to give them now. But if it was 4 o'clock, you'd have a green light and it would tell you it's time to give this medication. So it makes it easier for the nurse when she looks at it to see green means go, I can give that medication. So you don't want to be looking at this section here. You're going to look at the name of the med, the dose, So the dose is 6.25. The units is milligrams. The route is oral. Frequency is twice a day. And that's what you need to write down. So write that on your pad or your paper, whatever you have, and then you're ready to leave. Okay, now it's time to close down that medical record because you're getting ready to leave the hospital. You have your piece of paper. You're going to take it home with you. So now let's shut down and X out on Richard Royer. Okay, so everyone do that. So what's his primary diagnosis? Pneumonia? Okay. And did you guys find some other stuff wrong with him?
Dehydration.
Dehydration? Anything else?
Type 2 diabetes, hypertension,
History of heart failure,
dementia.
osteoarthritis.
Okay, so there was a lot of different things wrong in that. And you got all his medications. So you're ready to go. So you go home, you make dinner, you walk your dogs, you watch the boys, and then it's time to get ready for tomorrow. Okay, what we want you to do is, what I have on the board now is, this is an electronic book. This is your med-surg book, medical surgical book. Assessment and management of clinical problems. And so most of you guys have that big heavy book, is that correct? Not too many people bought the electronic version. But what I did is I pulled up pneumonia for you, because that's what you're going to do, is read about what's wrong with your patient. Okay? You haven't had pneumonia yet. You don't really know that much about it, so we have to study that. I don't want you at the hospital for 10 hours looking through a chart, all this stuff, and not really knowing what I need to look for or what it means. So we want you to spend your time pre-planning, studying about it. So you go to your med-surg book, not your Tabors or not WebMD online. Go to your med-surg book, and you're going to read about pneumonia. And it tells you, it's pretty intense, so you're going to go through it and see how you're going to care for someone. And then eventually you'll get to different parts that this page here tells you the diagnostics that are included with pneumonia. So this is where you start making your to-do list. So you need to make a list of things that I need to do or look up in the chart when I go back to clinical in the morning. Do you understand where I'm going right now? Okay, so I'm reading about pneumonia and I see that, the patient probably had a chest x-ray. So on my list, I'm checking, I need to find what the results of the chest x-ray is. I can find it in the chart before I get report, or maybe they told me in report. So you're going to do this in the morning. Okay, sputum cultures, pulse ox. These are things it's telling you that you should be looking at. Or oxygen therapy possibly could be on. So these are things you'll be looking at in the chart so you know what to look for. You don't have to sift through 1,000 pages of labs. You know which labs you're going to be pulling up and looking for pneumonia. They also had diabetes. So should you just read about pneumonia? You might not read as in depth, but there's things for diabetes that we need too, like such as what is their blood glucose in the morning. So when you go in there, that's on my to-do list. I need to look what their blood glucose is, or I need to look at this stuff. And so when you go to the hospital, you have a list of things you need to look up, and then you can do that quickly on the chart. Anything you want to add?
No, like she said, a lot of that too, you can get in a report if you listen one nurse to the next. If I'm going home and she's taking the patient, and I could say, he came out from the emergency room, his chest x-ray showed a right lower lobe infiltrate, pneumonia. You already got your results, you don't have to look it up if you listen. Because a lot of those things should be passed on, and then right away, you know, one of the other things I want to listen to is because it has something to do with their lungs. I'm going to listen to their lungs. Now, they said it was a right lower lobe infiltrate. So now do you think the right and the left are going to be the same? So, and we get to listen to lung sounds too, right? Because you have to. But now you know they may not sound the same. So it's important that you get those information is in reports sometimes too.
So you read about it, so it makes sense to you now, what they're telling you in report, and it makes sense of what you're looking at in the chart. So, well, my legs are all propped up, and I read that. So now it's time to go back into SimChart and get prepared for clinical. So now we're going to go to my clinicals. Okay, so everybody go to my clinicals.
Now this is your homework time. This is what you do at home.
Yeah, we're at home, right? We went to the hospital, we got the patient information, now we're at home, and we read about it, so we're going to fill this out. Okay, where you're going to chart for clinical is, you're going to go under Nursing 116, and you're going to find your clinical instructor, and then you'll see there's patients, and each week you'll chart on them. We are not in clinical right now, we're in lab, so where I want you to go is the one that says first patient. And open that up. Did everyone find it?
At home, it'll be under Mrs. Mensch or Mrs. whoever your other clinical instructor is. For now, we're going to go back out and you're going to go under first patient.
Okay.
This is the practice patient.
Since I open this patient up again, I'm not going to have the clinical setup that you see on the board, but when you open up in your computer, the first time you have to set it up. So what it's asking you for is first day of clinical. So it's today, we're going to clinical. So let's fill in today. Okay, next thing it asks is the patient identifiers. We have a law called HIPAA now, right? So do you want to put the patient's initials in there?
No.
I can't hear you.
No.
Okay. So what are you going to put in those boxes?
Our initials.
Your initials. It'll only take one initial in each box. So. Okay, then it's asking for the hospital floor. What kind of floor are you on now?
Med-surg.
So choose med-surg. And this is important to get the male or female right, or else everything in SimChart will be anatomically incorrect. Okay, so is this a male or female?
No.
Okay, and put the real age down. We do want you to do that. And then pick an avatar for what you think he looks like. And then under physician, or provider initials, your initials again, same thing. And then under credentials, what is it?
Student nurse.
Yeah, student nurse. Okay, then enter that. And then you're going to come to the page that I have on the board now. And you're going to enter your diagnosis. I put in pneumonia, so go ahead and find it under your diagnosis and put in pneumonia. And then this is your place to put the information for you to understand about pneumonia. We pulled up pneumonia in our med-surg book. It talks about pathophysiology. It talks about the therapeutic regimen on how to care for this patient with pneumonia. And you got, when you went to pre-plan, the other health problems that they have. So this is where you would type this information in. This is your notes. What I'm concerned about, not necessarily what's in here, it's what's up here. So I want to know when I come to you, I'm going to say, your patient has pneumonia. What is your plan for today? How do you plan to take care of them? Is there anything we should be concerned about that could be a problem in the future that we have to prevent? These are questions that your clinical instructor will ask you. So it's important that you put down what you need to know briefly so that you can refer back to this. Okay, so you would type in what you need to know for that. And your to-do list you can put right on here under the plan, the therapeutic regimen. You can put your to-do list on here, the things that you still need to check. And then we're going to print this out and take it to clinical then. And so you can have this right there. So does that make sense to you? You have questions? So you can do this for pneumonia, and you can add a new one. If you want to add, that was a primary, we can do a secondary one, and you can type in another one, such as diabetes, because maybe there's some information that you're not real familiar with that we want to study that a little bit more. But you're responsible to have an understanding about your patient. So when you go to clinical in the morning, you know which meds you have to maybe assess them before they're being given. You need to know what assessments are needed for pneumonia. What did it mean in report when they had infiltrates? So you've looked that stuff up on how to care for someone.
This is your cheat sheet for clinical, so you can print that out so you have it. So if I'm asking you a question in clinical, you have the answer. You're prepared to take care of that patient with pneumonia.
And then the other thing, we looked up medications, right? So I'm going to move on to the next tab down is medications. Okay. So I'm going to put a medication in, and if you just type the first several letters, it usually pops up. Maybe. Okay, so I selected this medication. Now, where do I find information about it? Did you guys purchase Nursing Central? Unbound Medicine? Okay. Do you notice that you have access through the internet too? So you can put it on your desktop computer? And then you just have to sign in with your username and password. So besides having it on your portal device, they also give you access online. So what I did was I looked up this medication. Carvedilol. Who wants to pronounce it? I don't hear anybody.
Neither.
Carvedilol? Carvedilol?
So how can we tell how to pronounce it?
Should tell you.
Let's press this button.
Carvedilol.
Alright.
So what are you going to tell your patient when you're giving their medication? How are you going to say it?
Carvedilol.
Okay, so that can help you too. Okay, so when you're going in, you're going to tell them what you're giving them, so you have to be able to pronounce it.
They'll ask, what am I getting and why am I getting it? And you looked that all up and you already know the answers to that, right?
So Davis Drug Guide, they're going to give you a lot of information. What we're concerned about is the pharmacological class, because you should be learning these medications by the pharmacological class, such as beta blockers. If you've had pharmacology, you would have learned that group. So you'd be looking and reading this stuff here, and then filling in back on the SIM chart. Let me get back to that. the classification was a beta blocker. If you can't find the classification, it's under cardiovascular meds. You can just type in beta blocker and it'll accept that. Okay. The route is oral. The dosage is 6.25 and the units were milligrams. So you see how you fill out those. Units could be milligrams, milliliters, units, whatever it's being dispensed in. Okay. And then here are some comments that you can make, and all this stuff is coming from what you're reading in Davis Drug Guide. Who has the good idea of just copying and pasting that whole thing in there? So before you give that medication, you're going to review all that. How long is that going to take you? Do I care that this medication is safe, is not safe for someone that is nursing a baby? Because a 92-year-old male does not apply. So you need to read through, make your own notes so that you understand this medication. And so then when you refer back to it, you have what you just need and what applies to your patient. Okay, so you fill them out for all the meds that you did. And I said, we haven't done medications yet, so we'll talk more about some of this stuff. But for now, fill it out the best you can. And when you have everything filled out, there's a tab that says report. And everything I typed in here will now show up, and I can generate it. And I can save it, open, print it, and take it to clinical with me.
Or you can email it to yourself and it'll be on your portable device.
Yeah, email it, whatever you want.
You don't want to kill it.
And that, so, and then that way your to-do list is right there, and you can just check it off when you find it in clinical. So the idea is when I go into clinical the next day, I know all about pneumonia, I know what I need to look up, so I go to my patient's electronic health record and I can find what I need. I'm not spending hours looking for something. So when should you find this information? When you get there in the morning. If you're having report first, you're going to hear report. If you have like 15 minutes or so before report, you make sure that your patient is there, and then you can start looking up some of this information.
She said if your patient's there, why do you think she said that?
I could go home.
You can go home. This is a 92-year-old male who's a do not resuscitate, who has pneumonia, which means it affects his breathing. What else might happen? Could have died, or he could have gone to a higher level of care, which would have been like ICU. So he may not be there. So just check to make sure they're there within like the first 10 minutes that you're on the floor. Not 2 hours later, let us know that somebody's not there.
What do you think your clinical instructor will say at 9 o'clock when you tell them, oh, my patient was discharged yesterday, I don't have a patient. At 9 o'clock, you started at 7, what's Mrs. Mensch going to say to you? What have you been doing?
Go home.
Yeah.
So any questions on how to do that? So in the morning, or in the afternoon, or the evening, depending where you go, because like at Mrs. Mensch's clinical site, it's going to be probably after 4 or 5. At mine, it's probably going to be after 1. And select specialty could be any time practically. So it depends when your instructor tells you you can go. You're going to take your piece of paper and write down just that little bit amount. It took you 5 minutes here. It should take you 5 minutes there. And then you go home, and this is where you spend your time to read about what's wrong with the patient you're going to be caring for. And then you fill out your pre-clinical manager. And then in the morning when you go, you make sure your patient's there. You look up the information that you need to look up now, because now I know about pneumonia, and I get report, and I'm ready to have a good day. Sound like a plan? Well, we hope it works.
Does anybody have any questions? And then seriously, if you have questions, this is the time to ask them, but anytime you have a question, ask. If you don't have the answer, the only way to get an answer is to ask the question. Don't be afraid. You're a student and we know you don't know.